Where health experts have converged for the 8th African Conference on One Health and Biosecurity. The theme for this year's meeting is strengthening health security and mitigating biological threats in Africa. The conference is also aimed at consolidating on the gains made in tackling various emerging infectious diseases, especially after the COVID-19 experience. Senior correspondent Adidoja Salamadini reports.
This conference is in continuation of efforts to ensure that Africa strengthens its health security to mitigate biological threats.
Participants from different countries around the world are in this transdisciplinary conference to meet minds on the most effective and sustainable way to protect against threats from deliberate and accidental releases of animal pathogens.
Yes, this conference showcases that our unity of purpose can tie down the lions of zoonotic infections, can tie down the lions of antimicrobial resistance, the lions of malaria and foodborne diseases. And as a result of doing this, we will strengthen health security and mitigate biological threats in the continent.
We have worked in partnership with our Nigerian colleagues to establish a One Health technical working group, bringing together partners from ministries, academia, and research institutes.
From Professor Akinbayomi's presentation on climate change and its biosecurity implications, in the next 50 years, Africa will be a continent of megacities with major health toxicity. Lagos, with a population edging towards 30 million inhabitants, now enjoys peace and stability after the heat of COVID-19 pandemic. But the megacity needs to be protected from future biological shocks.
In 10 years, we're going to exceed the threshold of greenhouse gases. And that means that the temperature of the planet is going to rise above 1.5 degrees centigrade, which means that we must drastically cut down on our carbon emissions.
Representing Governor Babajide Sanwo-Olu, the State Commissioner for Health said Lagos is fully prepared to deal with pathogens of high consequence.
We are increasing the capability of the Lagos State Biobank to carry out more molecular tests to develop this very elaborate research institute called the IDRI. Hopefully, we should be able to break ground in the next month or two, and this will become the institute where scientists can come to Lagos and carry out elaborate collaboration and research.
Lagos has encountered different viruses, from Lassa fever to Ebola virus disease, COVID-19 and monkeypox. Adidoja Salamadini, TVC News, Lagos.